digestive endoscopy in the Champalimaud Foundation Clinical Center is really important and has a central role. Well, it's really important this area of diagnosis because not only about screening, because we are doing all the screening of the colorectal cancer, the premalignant lesions, but also in the upper GI endoscopy, and so this screening area is really important, and this is an area that we are trying to develop here in the clinical center, and in an oncological center this makes all the sense. And then we have some different areas for diagnosis. Sometimes we are not doing screening, but we are trying to get fine diagnosis about lesions that we already know. And diagnostic endoscopy has this important role here. So we are obviously supporting all the other areas, the surgeons, the intensive care unit, the pneumology, well, all these areas, they will need us for this diagnostic approach. But then we have the other side, that is the advanced endoscopy. And I'd say that till 10 years ago we were doing just classical endoscopy, seeing the mucosa and taking off some little polyps, well, 10 to 20 years ago. But nowadays we have really powerful endoscopes, and so it's possible not only to see the mucosa, but to do a little bit as we are doing microscopy, so we can really analyze the patterns of the glands of the mucosa. And then we have also the possibility of attach ultrasonography probe to the endoscope, and then we can suddenly see not only the mucosa, but we can see behind the mucosa. So we can see the pancreas, we can see the liver, we can see the biliary tree, the mediastinum. And nowadays is more and more important this therapeutic and this advanced endoscopy area, you see. And in an oncological oncologically focused center, I'd say that this advanced endoscopy unit is really important. Many of the procedures that some years ago were done by surgery, nowadays we can do that. We may do that. It's perfectly possible to do advanced resections of mucosal lesions that some years ago it was impossible to do. And I'd say that with these ultrasonography probes we can also see adenopathies or nodes behind the wall in the mediastinum or in the abdomen, and go there and make a biopsy. So I think we have an important role here, and we are making more and more mini-invasive procedures and substituting surgery and cooperating with surgery, and this is the future of medicine for sure. There's a completely new area in endoscopy in the last 5 years. That is something that I call submucosal endoscopy. So nowadays it's possible to make a small cut in the skin of the esophagus or the stomach, we call it the mucosa, and then go between the mucosa and the muscular wall and do some procedures here. Before the treatment of an esophageal disease named achalasia, that is a disease of the motility in which the patients have great difficulty to swallow, was a surgical approach. And nowadays we may go with this approach of the submucosal endoscopy to this space that is between the mucosa and the muscular wall, go there and, like doing a microsurgery, do a small cutting of this muscular wall and substitute the surgical technique. Some of these procedures are done in ambulatory basis, and we may do that during the morning, and then we discharge the patient at night. And with surgery, usually we would have to have an admission for some days, and this is the great advantage of it. Not only in curative treatments, of course, but also if we are talking about, or mainly, or most importantly, if we are talking about palliative treatments, because these oncologic patients are patients that are submitted to lots of procedures, and the time for these patients is really important, and so if you may do something in micro or mini invasive basis, and then you discharge the patient some hours later, this is a huge benefit for the patients. I think that the future of endoscopy, in my opinion, it will be really amazing, because nowadays there are lots of developments that we are seeing, and one of the most interesting devices that is being thought is the use of magnetic forces to do some procedures that will substitute surgery. And so there are lots of ancillary devices that are being developed, aiming to substitute or to mimetize bariatric surgery. That is something that is more and more common, is the surgery of the obesity. The treatment of diabetes. Nowadays we have some devices being developed with the objective of treat diabetes. Well, it's a quite complex procedure, but I can assure you that it's much less complex than some surgeries that do this also, and the preliminary results are really impressive. So to be honest, I have to say that we have plenty of fields to explore and to develop, and I'm sure that we are going to do more and more things with endoscopy.